Now we are live, sir.
Yes, sir. ओके पठान सर,
हाँ बोलिए सर।
आप एक बार चेक कर सकते हैं क्या हम लाइव है क्या नहीं? आपके मोबाइल से एक बार ट्राई कीजिए यूट्यूब में जाकर।
यस सर।
फ्रॉम हियर तो लाइव दिख रहा है मुझे।
One minute. Yes, sir. We are live from this
Okay.
meeting.
It is good. It is working well.
Yes, sir. Sir, I think we want to share this YouTube link, YouTube live
Yes,
stream.
yes. I'm sharing it. I'm sharing in group. Okay.
Yes.
Okay, I have shared it.
Yes, sir.
So students above 100, if they cross the 100, they can watch
Yes.
live us in YouTube.
Yes, sir. I think guest is not in this meeting, so I will try again. I will call again to guest.
Let's call him.
Join हो रहे गेस्ट।
Yes, I think Deepak sir, na?
Yes, yes, join.
Yes, sir.
नहीं, मुस्लिम।
Good morning, sir.
Good morning.
सर आपको आवाज आ रही है सर? अलीम सर। Sir, it is mute now, sir. So kindly unmute your speakers. Yes. Sir, can you hear my voice, sir?
Yes, Pathan sir, please say.
Can you hear my voice?
Sir, it is not very clear.
Sir, am I audible?
Yes, sir, you are audible.
Okay, fine.
Good morning.
Good morning. Fine.
Okay.
So I will just upload the file of the PowerPoint. Whether we are able to see that, I will just share the screen with the PowerPoint.
Sir, I will make you a course so that you can also share that PowerPoint.
Okay, fine.
Okay. Okay. Just try it, sir, once.
Yes, sir.
Okay. It is visible, sir.
The screen, we can see the screen clearly, sir.
Yes, yes. We can see the screen clearly, sir.
Okay.
Yes, sir. Yes.
Okay, fine. I will just stop the
Okay.
sharing. Okay, fine.
Sir, for this demo. So after the student will join, all the students will join. I will inform you.
Good morning, all the students. Before the starting this webinar, today's webinar, I'm like to inform you, all the students, you should mute your mic and you can on your video. So at the time of question and answer hours, so you will ask two questions to respected guest.
Yes, sir. Okay, yes, gone.
We will start this webinar at 11 a.m.
Yes, sir. Sir, have everyone has joined, sir?
No, sir. Actually, time is of 11. No, so I think many students are still joining.
So this meeting we are also live streaming on YouTube also.
Okay. Okay, we'll wait till
I have
11.
also share this YouTube link on your groups also. So those students who cannot join this Zoom meeting because of the limitation of the participation.
Okay.
So you can also join this YouTube live stream. नहीं कुछ प्रॉब्लम।
हाँ, क्योंकि अभी वो बायोडाटा रीड करते
students are request to mute your audio, and you can
Yes, sir.
Pathan sir, if student cannot unable to mute their video, then you can also mute their video,
okay, sir.
audio
Okay.
also.
Okay, sir. I have muted this student, sir. So no problem is here. Today's webinar we will start at 11 a.m. So
Yes.
at that this webinar, we have divided this webinar in two sections. So first section is today's chief guest will give full introduction or full information about the life after COVID-19, what will changes, and how vaccination helps to prevent disease. So this is a today's webinar topic. And after this webinar, students can ask to today's chief guest. So guest will answer of your all the questions. So these are the two sections we will divide it. So I request to students, you cannot answer, you cannot question to today's guest in within the webinar. So we will inform you, and you can also write your questions in a chat box also. So we will ask your name, and you can also ask the questions to the today's guest.
Yes, sir. Best way is to write a question in chat box
Yes, sir.
so that we can read it and we can also name the student.
Yes, sir. I request to all the students, you should mute your audio and on your videos. And make a discipline in this webinar section like in lectures. Within the 4 minutes, we will start this webinar. I request students, you should mute your mic and on your video. So, Jaswal sir, will I start this webinar?
Yes, Patan sir. It's 11 and almost our meeting is full with 100 students and
Yes.
many students are joined our YouTube channel live. So definitely we can start, sir.
Yes, sir. Yes, sir. Yes. Thanks. So, very good morning to all the dignitaries, teachers, and all my dear students. My name is Pathan Uzeb Khan, Assistant Professor of Shaikh of Pharmacy, Aurangabad. So, we are greeting to warm welcome to all of your present today's webinar, jointly organized by Shaikh of Pharmacy and Shaikh of Pharmaceutical Education and Research, DFARM. And on the today's webinar topic, life after COVID-19, what will changes and how vaccination helps to prevent diseases. So now I request to Shruti Dhake ma'am to introduce our today's honorable chief guest, Dr. Alimuddin sir.
Yes, sir. Respected chief guest of the today's event, respected principal sir, respected principal ma'am, all the HODs, all the faculty members and the students. A very good morning to all of you. I am Shruti Dake, Assistant Professor from Shreeyash Institute of Pharmacy. It gives me an immense pleasure to introduce our chief guest, Dr. Shaikh Alimuddin sir. He has completed his degree, graduation, BHMS from the Maharashtra University of Hair Science, Nashik. After that, he did his master degree in the pharmacology from the MGM IHS, Mumbai. And he also completed his PhD in the medical pharmacology from MGM IHS, Mumbai. Currently, his PhD topic was to study the analgesic, anti-inflammatory, anxiolytic, hypoglycemic, and hypolipidemic effect of Moringa oleifera leaf extract. Currently, he is working in the MGM Medical College in the Department of Pharmacology as the assistant professor. Then we will see his additional achievement. He is a co-author in the book of pharmacology for the undergraduates, and the publisher is the Bhalani book. Then conferences, paper presentation. He attended its own conference in the Bangalore in 2014. He presented paper in the Inventum conference in year 2013. Then paper presentation did an Inventum conference in year 2018. He presented the paper in the Neuroscience conference in Cochin in year 2019. And he has attended 6 national conferences. Then regarding his publication details, he has did the number of cohort studies totally 2. Then the number of case control studies are 5. Then the number of review articles published by him is 2. Number of book published by him is the 1. The total number of publication is 9. And out of this, there are the 3 top publications in the journals. First one is the European Journal of Pharmaceutical and Medical Research. Then the second is World Journal of Pharmaceutical Life Science. And the third one is the Annals of International Medical and the Dental Research. So these are his top 3 publications. Rather than this, his other academic achievements that he is top in the history, geography, in SSC in Maharashtra. Then first extensive pharmacological activity of Moringa oleifera leaf extract was done in his new activity of this plant in his PhD thesis. He is having total 11 years of experience in the teaching, and in spite of all these achievements, the great achievement now currently with this situation, he is working in the COVID section in MGM hospital. He is the frontline warrior in this, and as we know that all we are suffering through this pandemic situation, and the solution to this situation is the vaccination. So how this vaccination will help to prevent the disease, and what will be the life after completion of this vaccination? To know all of this, now I request Dr. Shaikh Alimuddin sir to please share his knowledge and update our students with your knowledge, sir. So please, sir, please welcome for the webinar.
Thank you. Thank you very much. Actually, that introduction was a big one, but actually we are also simple. As we are progressing in the field of medical sciences, we are also facing the challenges. The most important thing is today it is one of the biggest challenge, that is the COVID-19 that has come. And whatever, if you see the studies and whatever we are doing, actually in the MGM Medical College, in the Department of Pharmacology, we are also having the clinical trial unit. Actually, that is a CRO, clinical CRO. That's why we are having all these trials. Whatever the vaccines that have come in the market already, that has been whatever the testing of that clinical trial in the human has been done in our MGM Medical College before 1 year. Okay, so that with that I will start with the basics, the presentation. Now I'll start with the presentation of the sharing of the screen. Sir, is the screen, everyone can see the screen?
No, sir.
No,
Huh?
sir, no.
Okay, fine.
No,
I'll
sir.
just
Yes.
a minute. Fine. I will share the screen, sir.
Yes.
Okay, sir. Now
It is visible, sir.
Yes,
are you
sir.
able to see the screen, sir?
Yes, sir.
Fine.
Yes, sir.
Yes, sir.
Now, before starting with the topic, actually, even I have suffered COVID 2 months before. But most important thing is that as we were the frontline workers in that, we had been vaccinated for the Sputnik. Even myself, in the clinical trial, I had been vaccinated for the Sputnik. The Sputnik now has been launched, but before that, the trial has come and we have been vaccinated. I had no symptom or even a mild symptom except sore throat. I did not have any symptom. And even whatever the investigation like the CT scan, that is the HRCT was done, no changes or any signs of COVID were there. So that is the thing that we have to be aware. There are many misconceptions in the society that whether the vaccinations are harmful or some persons they are spreading that whether it is useful or not. For that, even I had discussed with the Udev sir. So I wanted to talk with the pharmacy because it is we are all healthcare workers. And a healthcare worker should be aware of the whatever the current guidelines are there. So with this, we'll start with the topics now. I have just started with the COVID basics, and then we'll further shift over to the vaccines. Now, if you see the initial response in the virus, now what has happened here is COVID is the virus which is belonging to the most important RNA group of virus. Okay, ribose nucleic acid RNA group of the virus. And most important thing here is this is a endemic in the bats. Okay, a disease which is endemic in the bats, but what has happened is it has spread to humans. The same thing was there previously, that was in the same group, that was called as MERS. MERS means Middle East Respiratory Syndrome, and second was swine flu. Now what has happened is in the swine flu, that transmission has taken from the pigs, and that was transmitted in the humans, and that created a havoc. Now how that transmission is there, various theories are there, we are not going into the detail. Now here what was there is the most important was the COVID. Now COVID is the coronavirus, as we can see that will be seen further. In that case, what we had seen is the initial response in the virus. Now what happened is on the 31st December 2019, a cluster of pneumonia cases were detected in the city of Wuhan in the China. Now after that, in 1st January 2020, what happened is the World Health Organization activates the incident team management. They look after the cause. What is the cause of sudden rise? Now after that, in the 5th January, the World Health Organization, they issued the outbreak news. Okay. Now on the 23rd January, restrictions were there in the Wuhan. All transport that was suspended. Now this phase that was there, if you see there, the cases were not rising. On the 30th January, the World Health Organization declared public health emergency, which was of international concern. That is, it is not only the China is concerned, but it may be a thing that should be taken into concern all over the world. Now, after that, this continued till the 4th of February. The strategic preparedness was there and response plans were issued. On 11th of March, the most important thing is World Health Organization declared it as a pandemic which is involving all over the world. Now, if you see after that, you can see here the cases had jumped like this. So you can see that the color dot that indicated the countries. So indication of the countries, you can see that the Europe, Africa, America, all these were involved. And most importantly, what we were concerned was the death rate. Infectivity index of this was really high. So on that basis, what was happened? The COVID-19 spreads outside the China. Now, whenever outside the China, the first nearest country that was confirmed was the Republic of Korea. From the 18th February, you can see that there was a rise, and it was till the 3rd of March. You can see that the cases from 31 to the 4,812. So this was there. After that, Iran was the second country. Now you can see the most important thing is the rate of infectivity. From this graph, you can see that there is a rise in the peak very fast. So that is due to the infectivity of this virus. What we are concerned. So for that, what was the initiative? What India has taken is from the same streamline, that is mass gatherings such as religious events were stopped in the South Korea. Then whatever the football league matches were there, that was stopped in the year. Now the case fatality ratio, though the case fatality was less, but the morbidity means the more of the hospitalization was there. So in this scenario, what has happened is in the many countries, the COVID-19 led to the community transmission. What is the meaning of community transmission? Community transmission is where if one person in the home is involved, whole of the family gets involved. And that is the thing that we are facing an important healthcare issue. Inadequate healthcare issue, that is number of beds availability, especially in the Indian scenario, we are having less. Whatever the frontline workers like doctors, nurses, staffs, hospitals, so that is a limited number. So for that, what is there is what we had applied last year also, and now we have applied, that is the lockdown. Okay, lockdown is there to flatten the curve. Okay, that concept is called as flattening of the curve. The flattening of the curve is important in any country because of the limitation of the whatever the availability of the resources is there. On that basis, what is there is, along with that, what we are doing is we are causing it as a clustering. Clustering means whatever the persons who are infected or having the symptoms, we isolate them. So for that, what we are doing, we are having a three-prong approach. What is a three-prong approach? The first approach is mass testing. We increase the testing. Next one is isolation of the cases. Now, isolation of the cases is followed by contact tracing. Now, contact tracing is very, very important for flattening of the curve. Now, in the first what wave was there last year, what we had done was we were having the contact tracing. Nowadays, what we are doing is testing, isolation, and importantly, the ones who are having mild symptom, we are isolating them at home, where the facility is available for a separate unit. That is, the person should be isolated in a particular room. He should not reside with all the persons. So that is called as home isolation. The persons who are having symptom in the severity grade, they are then hospitalized. Now, in this basis, last year we had very effectively managed it, and we had a decrease in the cases. Now, what initiatives we were taking? The same thing, lockdown was there last year. So what we have done is, where the mass social persons will be gathering, that we have stopped. So what we have closed is, we have closed the schools, shops, workplaces, restaurants. Even along with that, we have closed the borders. For that, we have in the Maharashtra, we have Jilla Bandi. Okay, So the same thing is there, that we are limiting the spread of the virus. And the most important is here the measures are taken to slow down whatever is the transmission, so that the recovery rate will increase. Because if you see the yesterday's guideline by the Honorable Chief Minister of India, what they have done, that is called as a positivity rate. What is the meaning of positivity rate? How much cases in a per 100 person are positive. For example, here in Aurangabad, especially scenario, it is positivity rate is 5. Previously, before the lockdown, the positivity rate had gone up to 20. Means if you are testing 100 persons, 20 would be positive. Now, what is the positivity rate? It is now out of 100, 5. So 5 is an amount which can be, okay, we can stop the lockdown. So for the implementation of the social measures, what is there? So here, the most important thing is what measures we have to take. Now, on the part of the person as a responsible person, for the even as a healthcare worker or even a common man, the personal protective measures are very important. What is there? One is hand hygiene. Now, the transmission is there by the contact. For that, we have the hand hygiene, frequent washing. Next one is respiratory etiquette. What is the meaning of respiratory etiquette? Even the sneezing should be there. We are putting the hand. Next, use of face mask. Now, in that, many questions were arising previously, that which face mask to be used, what to be used. Now, in that cases is there, that the guidelines are there. The healthcare worker who is exposed to the known or at risk places, so they are advised to use N95 mask. The N95 mask, it will give a protection of 95%. For a common person, it is advisable to use a 3-ply mask. Previously, it was said that cotton mask should be there, but now it is said that it is only 65% effective. The 90% effective is a 3-ply mask or simple mask. So nowadays it is advised that whenever you are using it, you should use a 3-ply mask. Next one was social distancing measures. Yes, this is a very, very important. At least a 1 meter social distancing is advised. Why? Because this virus transmits in the air. So it is airborne to a certain extent. After that, it gets deposited. So here what is there is, more the person is in a close proximity, more will be the concentration of the particles. If that more of the concentration of the particle enter through the nasal tract, what will be there? The person is likely to get infected. Okay. Along with that, what we had done is contact tracing, isolation of the sick individuals, quarantine of the exposed. Now, for example, if one person has come positive, what we are doing is we are isolating that person and we are observing it for at least 10 days. If the symptoms are not there, then he can move on. The school measures, workplace measures, avoid crowding that were taken. Now, next one was the approach was the environmental measures. Now, if you see the environmental measures, surface and object cleaning. So you can see that there was a big rise in the use of the sanitizers. Now, in that, I want to say that yes, sanitizers are effective, but it should be of at least 70% ethanol or alcohol. Nowadays, many marketing is there. I don't know how much concentration is there. That is also doubtful, because nowadays what the mass production is there, and so we have to take care that if that ethanol or 70% alcohol is not there, it won't be effective for the surface cleaning. So simple measure is there, very simple measure, sodium hypochlorite. Even if you are cleaning the surface with the sodium hypochlorite, which is easily available, more economical, if you want to dilute it, just a 15 ml will dilute it for 2 liters. So even that sodium hypochlorite is effective. Next one was the initiative is the increased ventilation. So no air conditions, open spaces where you want to meet. Next one, even as the healthcare workers, you can see that we have stopped looking in the OPDs in the closed surface. So what we are doing is patients are being seen in the open environment. Why? because the suspended particles are more likely to be getting infected. If one person has come, maybe he is COVID positive. After that, whatever the particle or the with the sneeze or with the air suspension is there. So after that, what happens is that will be suspended. Another patient is coming. After that, if that particular concentration is there, that might get infected. In the open air with the increased ventilation, what is there is that risk is minimized. So for that, you have the Swiss cheese respiratory model. Now here you can see the Swiss cheese model. What we are doing is recognizing that no single intervention is spread. So here personal responsibilities are there. Second one is shared responsibilities are there. Now personal responsibilities, what we have just discussed is the whatever the social distancing is there, hand hygiene, and shared responsibilities with the society. In the society, everyone should be there who will be taking initiative that they will be having a social distancing. So this model is very, very effective. Okay. So in this measure, what we have done is here travel related measures we have taken, that is travel exits, border closure, entry and exit screening. Now coming to the virus, whatever the virus is there. Now SARS-CoV. Now SARS-CoV stands for subacute respiratory syndrome. Now it is a coronavirus, that's why COVID and 2. 2 is a new, that's why many times you can see the word NCOV. It is the new coronavirus 2. Now where is the localization? So first, as soon as the nasopharyngeal tract gets localized, you can see that the infectivity is more in the lung. In the lung, especially the alveoli. Now in the alveoli, it causes inflammation. Now when there is an inflammation in the alveoli, most importantly here, you can see that this inflammation causes an inflammatory reaction in the body. So this is characterized by changes in the blood. Now what are the changes in the blood? Leukopenia, thrombocytopenia, lymphopenia. Whatever the immune mediators are there, these are getting decreased. This provokes a reaction. This reaction is called as cytokine storm. Now cytokine storm is one of the critical phase which we have to monitor. Now in the cytokine storm, what is there is a rise in the inflammatory markers, that is interleukin 1, 6, 8, then chemokine receptors are there, CCL, CCL2, these are there. Now when these inflammatory markers are there, this will cause the damage to the body. What are the damage? Inflammation in the body. So what will be there? Inflammation of the kidneys, inflammation of the liver, all these inflammation will be there along with the lung. So here at this stage, you can see that the patient starts getting symptoms. What are the symptoms? Dyspnea, dhap lagne, dam lagne, thoda pan challaga, dam lagne. So here, what we are getting, the most important is the complications of this. Now, what are the complications? If you see the inflammation in the lung, that will give rise to the COVID pneumonia, or also we call it as COVID pneumonitis. Now, in the COVID pneumonitis, there is an inflammation of the lung. Now, this causes a decrease in the oxygen perfusion. So that's why there is a decrease in the saturation. So that's why what you can see that many times in the hospital, they are telling and seeing the oxygen saturation. It is with the use of pulse oximeter. So what we are saying is with the pulse oximeter, there is a monitoring of the saturation. When the saturation is going down, it is indicative that yes, there is an inflammation in the lung. Now it is not only the lung which is getting inflamed. You can see here renal acute kidney injury is there, hepatic liver enzymes are raised. In the gastrointestinal system, many times the patient complains or comes with the history of diarrhea, nausea, vomiting. Okay, these are also the symptoms of COVID. Along with that, in the myocardium, it is the acute myocardial myopathy, inflammation, then hyperglycemia, dermatological rash is there. The most important complication is the pulmonary embolism. Many times what we are seeing, the major death in the COVID-19 is due to the embolism and thrombosis. Embolism and thrombosis, the most important thing, this will cause the sudden cardiac death and sudden death. So for that, what we are having is that most importantly, we are tackling this with the use of multiple intervention. Now, in this, what we are doing is, if you see here, the intervention, what we are doing is, we are decreasing the inflammatory markers. For decreasing the inflammatory markers, what we are using is the potent anti-inflammatory drug. Which is the potent anti-inflammatory drug? Steroids. So that's why what we are using here is the corticosteroids. Corticosteroids are one of the important life-saving drugs in the management of the COVID-19. Next one is whatever the inflammation is along with the secondary infection. So that's why for that, what we are tackling is use of appropriate antibiotics. Now, along with that, what is there is inflammation. Whenever there is an inflammation in the vessel, that leads to activation of coagulation pathway. But when that coagulation pathway is activated, what will happen? Thrombosis. And that will be acute thrombosis. For that, what we are tackling is use of anticoagulant. So altogether, what is the management is? The medical management is the use of corticosteroid. This will take care of the cytokines. Cytokines means interleukins, whatever the inflammatory marker. Second is anticoagulant. When you are using anticoagulant, what is there is? Anticoagulant will take care of the inflammatory changes and hypercoagulable state. So coagulation cascade will be inhibited. Next one is, along with that, we are giving the supportive care. What is the supportive care? Here, oxygenation. You can see that many times you have seen the scenario on the television. Now, many times that is a confusing state, but you have to explain that it is not only the oxygen that is required. Along with that, the whole management requires a in-hospitalization. Now, here when we are having an in-hospital management, then we are able to tackle the whole management. So, oxygenation, along with the corticosteroid, along with the antibiotics, along with the anticoagulant. This is the mainstay of the management in the COVID-19. Now, whenever there is a COVID-19, all this is there under the observation. Now, what happens many times where the mortality is more? You can see here, many times the patient comes in the hospital in the cytokine storm. Now, what is the meaning of cytokine storm? See, the normal level of the C-reactive protein, one of the marker is C-reactive protein. Normally, the marker is only just less than 6, 1, 2, 3, 4, that may be there. That is normal. When we are seeing the patients of the C-reactive protein, CRP, and second one is D-dimer. Now, that is elevated even 1,000 times, 1,000 times, I am telling you, 100 or 1,000 times. So, D-dimer, it should be 0 to 1. That is coming 2,000, 3,000. Now, from that, you can imagine what sort of inflammation will be there in the patient. Literally, when we are seeing the patient, many times the patient says that I am not even able to breathe. Mala shwas pan yeta yet nahi. Why? Because there is a whole of the inflammation cascade. And the vulnerable population, what is the vulnerable population? Elderly age group, those who have diabetes, those who have hypertension, those who have comorbid condition like atherosclerosis. These are at risk of sudden death. So if the patient, many times when the patient is coming to us, and if he is in the cytokine storm is whatever the earlier stage were there, he had not come and he has reported at a later stage, then the chances of survival are less. So for that, we have to take care that the most important thing is what scenario we have is hospital and healthcare workers are facing the rise in the demand. Most important, personal protective equipment, oxygen. Next important thing here is the beyond the health crisis. What is the health crisis? Now, many persons are losing the jobs, except international travel is there, schools are being closed, but we have the thing is there that what we tell that if you are surviving, then and then only you are able to progress. So the thing here is, the most important thing is what you have to do. The three places are there, what we have focused in the management of COVID-19. That is, open air spaces are more than enclosed surfaces, what we have discussed just now. Then proximity. 1 meter distance more safer. Next, shorter period are safer. This is very important nowadays. In the clinics, what we are focusing in the patient, we are not seeing the patient more than 1 minute. What is there? Shorter period are safer. Lesser the time, lesser will be the infectivity index of that patient. So we are seeing it in that phase so that the patient or even other patients are not risk. Now in this scenario, though we are having the management or managing the whatever the acute cases are there, but the most important thing is prevention. So that has accelerated now. So COVID-19 accelerated development as there. If you see as of now on the 2nd March, 76 COVID-19 candidates are there under development. It is said that more 182 candidates are in the preclinical development, and most importantly, what we are designing the schedule is only 2-dose schedule. Nowadays, if you see whatever the vaccination camp is there or the schedule is there in the India, it is a 2-dose schedule. Now, what are the candidates in this? If you see the candidates, the 4 candidates in the phase 4 trial, that is, which are being currently used. The most importantly is AstraZeneca, University of Oxford. So Serum Institute of India, this is the Covishield. So Covishield is the most important, which we are having a mass vaccination. As of date of today, we have had the highest of the vaccination in the whole world. 12 crore people have been vaccinated. It is the highest achievement as a part of India. Okay, we also have the other like the Pfizer, Moderna. These are being given emergency authorization use, EAU. So emergency authorization use is being given. Now we have other candidates which are there in under the evaluation. These are the CanSino, that is Beijing Institute of Bio, Gamaleya. Now Gamaleya Research Institute, this is the vaccine, that is Sputnik. Now recently, even yesterday, the Serum Institute of India, which is manufacturing COVID-19, they have been given permission for the manufacture of Sputnik also. We have the Jensen, Novavax. We will be seeing that further individually. Now, though we are having the vaccines, but still there is a concern today. Now, if you see the concern, what is the concern? The most important concern is the mutation of this virus. New SARS-CoV variants are there. Now, SARS-CoV variants means it is getting adapted to the environment and it is using other modes for entry. Now, here, yesterday's news is there that whatever the second wave in India was there, that was due to the Delta variant of the COVID. And that variant was even escaping those who had vaccination. That was partial vaccination. What is the meaning of partial vaccination? Those persons who had taken only one single dose, second dose was not taken. For example, if they had taken Covaxin or Covishield, one dose was taken, after that they had been infected. So that does not confer complete immunity. So that is the news. So whatever the havoc that was created, especially in the February, March, April, in the India, that was due to the Delta variant. Even Maharashtra suffered much with that Delta variant. Now this Delta variant, actually it is a combination of a variant that was from the Britain and Africa. Okay, so now we have classified it as a Delta variant. Now here mode of transmission has not changed. The very important, what we had taken it as a very on a light mode was that in between when the cases dropped, we had opened the market, we had no restrictions. That was the time that this spread like anything. After we got the symptom again, we had to implement the lockdown. So that's why we have to remember that mode of the transmission of the virus variant has not changed. It is whatever the respiratory secretions are there, the same preventive measures we have to continue further. Okay. Now, starting with the topic of the immunity. Now, how we are developing the immunity? For that, most importantly, you can see here that the virus particle, it gets ingested. Now, when this gets ingested, the antigen presenting cells display the pieces of the virus to the T helper cell. Now, the T helper cell most importantly, it stimulates the cytotoxic cell. Now the cytotoxic cell, they stimulate the formation of B and T cell. Now this recognizes the virus and it gives a immunity for months and years. Now what we are doing today with the vaccine, we are doing today with the same thing. That is, we are training our body without getting the infection. So our aim in the vaccination is the same thing. We want to have a long-lived memory cell, so that here what will be there is, we will be having, the most important thing is immunity, which will be conferred against this. Second one is the stimulation of the B cell. Now B cell make antibodies that block the virus from infecting more cell. However, you can see that this variant is undergoing mutation. Mutation means changes to adapt to the environment. What it does is it changes itself so that it bypasses this B cell, that is the beta cell. Now B cell are again stimulating the T cell. So most importantly, what we are having is long-lived memory cells are to be stimulated. Now, if is how we are doing that, we are doing it by the vaccines. Now, if you see the vaccines, how we are doing it. Now, in that form, the most important thing is the isolation of the virus was very, very difficult part. Now, that isolation part was with the culture of this virus. Now, remember, the culture of the virus was very, very difficult, and to our very happiness, the one of our seniors in the pharmacology, that is who is in the MIT, Massachusetts Institute of Technology. He is from MGM Medical College. He is the person first in the world who has cultured and isolated this virus. Okay, so he's from MGM Medical College, from our department. So he is now in the MIT, Massachusetts Institute of Technology, USA. Now from there, we had cultured it successfully, and from there we have started the development of the vaccines. Okay, so what we are doing is we are using various methods. Now this is a trial one. Whatever the vaccines are there, actually if you see any drug to come in the market, it will take 20 years, 10 to 15 years on an average. Now here, whatever the vaccines are under there, they are under trial. We are getting it by various methods. Everyone is trying. So what we are trying is, one is weakened virus, that is antigenicity is lost. So this is a weak virus which won't cause infection, but it will give the immunological response. Second one is killed type of virus. These are the dead virus. Third is various components of the virus are broken down and they are injected. Okay, so in this way we are using the virus. So in one way we can see that the immune cells mount a response to fight the virus. For that we can have it as a thing that we are sending a virus and our cells are ready. So cells are ready without infection. So that's why the body says practice on this weakened virus. So this weakened virus will cause a immune response, but not infection. That is a very important thing. Many times misconception that the vaccine has caused us the COVID infection. Many times you can hear on the television, that is not right. The thing is that weakened virus will cause an immune response, not a COVID infection. Now, what is there? When the immune response retains a memory, in the memory the cells are already there. So what they will do? Very simple. They will target the virus and inactivate the virus. So what are the types of the vaccines now? The most important vaccines are, the first what we have discussed now is the weakened or inactivated virus. Now weakened or inactivated virus, again it will give the immune response. Why? Because this is an antigen to the body, a foreign particle to the body. So this will cause a weakened response. Whatever the weak virus will cause a good immune response. Now this is a common thing what we are using previously. Example, measles, mumps, rubella, MMR vaccine, smallpox, yellow fever. These are we are using already previously. Okay. The second one is, instead of the entire virus, what we are doing is only one certain component of that virus, which we are calling as virus proteins, or what we call it as shell proteins. Now in the shell proteins, what we are doing is we are administering the shell protein. Now, again, these are taken up by the cell, and it also gives a good immunological response. So we have the examples. What we are previously using is hepatitis B, whooping cough, shingles. These vaccines are already being used. Next one is the DNA vaccines. Now, DNA vaccines, most importantly, they encode the viral proteins are inserted in a plasmid. Plasmid, these are one which will be carrying the material inside the cell. Okay. Now, when these are carried inside the cell, these are called as messenger RNA. In the messenger RNA, this will cause a immunological response. Okay. So we have the West Nile virus in the horses, but we are not using it for humans. Next one, what we are using is the RNA vaccines, because this is a part of RNA. As this belongs to the group of the RNA, we are using it for the genetic instruction. So what we are doing, RNA encoding viral proteins are there. Now these are coated in a lipid coat so that they are entering into the cell, and there they are giving a response by making the immunological system. So here the most important thing is how the viral vectors. Now this is the vaccine which is now in the whatever the particular discussion is there. Now the Sputnik is one of the vaccine which is using a viral vector. What is the meaning of viral vector? Here we are using a virus which is non-infective in nature. We are giving that virus a particular target, that is, genes are encoded, viral proteins are placed on the non-disease causing virus. This virus enters the cell. After entering the cell, this gives a very good immunological response. Okay, so that's why you can see that the non-disease virus replicates within the cell. Antigen presenting cells take up the virus, break into the pieces, and those are presented for the immunological response. Now, in the same group, what we had presented was the same thing, Ebola vaccine. Ebola vaccine also was there, which is effective, and you can see that Ebola virus was also creating a big havoc in the African countries. So on that basis, you can see that we have the various vaccines. The first vaccine, that is the vaccine from the US biotech. Now here the mechanism of action. Now, as we are all knowing regarding this, that mechanism of action we have already seen previously. So here what we are doing is, in this vaccine, we are having the synthetic messenger RNA, which is injected and translated quickly into the proteins by the host. So this delivers the genetic information inside the cell. Now, after that genetic information, what is happening is the immune response is there. Now, here 2 doses of the drugs are given. Now, here they have demonstrated a good immunogenicity. Now, here what is there is, whenever any vaccine is there, if it is given, that will give rise to a good immunological response. So a good immunological response will give rise to some symptoms. Now, what are the symptoms? Headache. Next one is fatigue, myalgia, pain at the injection site. Most importantly, these are the adverse events are there, but these are self-limiting. So that's why you can see that most of the reactions are improved after 2 days. Next one is efficacy. No vaccine is 100% effective, but the more one which is having a more effectivity, that will be the good one. So this vaccine has 90% efficacy. Next is the Moderna. The Moderna is very commonly used in the US. Now it will be given a emergency permission in the India. Especially we will see all this vaccine will be coming in the next 3 to 4 months. So it is using the same principle, that it uses the messenger RNA to express the proteins. Now here what is there is the binding sites are different. Okay, so that is called as the 2 proline substitution is there on the space, that is the 986 and 987. Now this is there to increase the immunogenicity. Again, you can see the dosing. Again, generally it is said that we have to have at least 4 to 8 weeks of gap in between the two doses. Why? So that we are having a booster, whatever the booster dose we are giving in the, especially the common vaccines like that, 4 to 8 weeks are sufficient for getting a good immunological response. If you see the efficacy of this, 94% efficacy is there. Next one is what we are using in India is the Oxford or AstraZeneca vaccine. In India, it is marketed and produced by the Serum Institute of India, that is the Covishield. Now, here it is developed by the University of Oxford in the UK and AstraZeneca in the Cambridge. This vaccine is based on the replication deficient chimpanzee adenovirus. So what we are using is a vector. Okay. Again, what we have seen is when the vector is used, you can see that it will give a very good immunological response. Now, some reports were there in between that it was causing increased rise of thromboembolic event or atherosclerosis. Now that was investigated in the population, but that risk is very, very minimum. Okay, so this issue was there with the Covishield in between the last month. Even we had that issue, we had the study even in MGM Medical College, we had studied whatever the patients who were given Covishield. So our center is for the even adverse drug reporting center for the Western Maharashtra, MGM Medical College, and even I myself I am looking after the adverse drug event. Okay, so whole of the adverse drug event what were reported regarding the Covishield, I have reported them to the government of India. So here what we have seen is no such adverse event were there. Now, if a person is already having a ischemic heart disease, maybe that may be the reason for the death. Death was not there, but adverse reaction were there. Common adverse reaction are common, that is the headache, body ache, pain, malaise. But as such serious adverse event were not there. However, you can see one issue is there with the Covishield, that is you can see the efficacy. Efficacy is 74%. If you see the efficacy is 74%, that means what is there? That yes, the person might be infected. 24% or 26% population might be at risk again to get infected. So next one is the Jensen vaccine. Now Jensen vaccine, actually this vaccine trial is being done even in our MGM Medical College Aurangabad. It is under the trial. So the trial was interrupted even at our center, most importantly for unexplained weakness. After getting the vaccination, some of the volunteers, they had got unexplained weakness, sudden fatigue. Now for that, this was briefly interrupted, and this Janssen vaccine is not permitted to be used in India, because what we are doing is, first of all, what we are taking is the clinical trial of any vaccine, though it may be effective all over the world, but we have to take it in each of the center in India. If that is not causing any adverse event, then and then only the emergency use authorization is given by the DCGI, that is the Authority Drug Controller General of India. So this drug may not be coming to India because it was having one of the important brief illness was sudden fatigue. Next one is what is under the discussion is the Sputnik. The Sputnik, actually it is made by the Gamaleya National Center for Epidemiology and Microbiology. It is based on the human adenovirus. Now, whatever the Covishield is using is the chimpanzee adenovirus. Now, it is based on the vector, that is human adenovirus vector. Now, here again we are having the protein particles, whatever the protein particles of the virus are there, these are being loaded on the adenovirus, and these are. Now, you can see the most important thing is the efficacy. The efficacy is highest in this. 94%. So that's why you can see that this has been given use, and most importantly, you can see that just within 15 to 20 days, you will be having the centers even in Aurangabad. We are having the center at Aurangabad that will be declared soon. Now, regarding the trial was conducted even at MGM Medical College last year before the marketing of this. Whatever the volunteers, especially the doctors who in the MGM Medical College, we were vaccinated for Sputnik and no adverse event were seen. It is a safe vaccine. Now next one is CanSino and Sinovac. Now these are the vaccines which are prepared from China. So 2 vaccines under the trial are adeno, that is adeno and COVID vaccine. So Beijing Institute of Biotechnology and CanSino. Now these are based on whole virus. So whole virus which is inactivated. Okay, the whole vaccine which is inactivated form, these are given at 2 doses apart. However, actually we are skeptical or we are a bit cautious regarding this vaccine. So for part of India, we are not using it. That are our concerns, because one is the most important thing, it is under the trial there only. Second important, the strong data regarding its efficacy is not there. Now this vaccine has been used in Turkey. In 1 million population, they have used it, but we are a bit cautious regarding this vaccine. We are not using it in India. Okay. Next vaccine that is prepared in India, so that is Covaxin. So Covaxin has been developed by Hyderabad-based Bharat Biotech International, and it is in association with the ICMR, that is Indian Council of Medical Research and National Institute of Virology. Now here it is one of the thing what is there with the Sinovac. So Covaxin is an inactivated viral vaccine. This vaccine is based on whole virion inactivated virocell derived technology. So they contain the inactivated virus. It cannot infect the person, but it can train the body for the defense mechanism. Now you can see that we have the reports regarding the Covaxin. Now reports regarding the Covaxin is there. Efficacy is good. Covaxin 84%. Now the most important thing here is the 2 to 3 reports have come that Covaxin was even effective against the mutant. What is the mutant? This mutant, Delta variant. So those persons who had taken the Covaxin, they had very mild symptoms in the persons who had taken Covaxin. Okay, so that is the issue. Now regarding the summary in this, the discussion what is there is whether to take the vaccine, what to take the vaccine. Now that is a dilemma. Now in general, the most important thing that you should have clear in the mind, any vaccine is safer. Now regarding the efficacy, if you want to have a good efficacy or effectiveness, now we are going in for Covaxin and Sputnik nowadays. Covishield is also good, that is not a question. Now the efficacy is there, but the most important thing in Indian scenario is availability. You can see that the Covishield is available now, and even now we are having the plan to vaccinate the persons who are above 18. Previously what we had, the plan was above 45 years old. Now due to the availability of the vaccine, now even above the age of 18, also healthcare workers, they are being vaccinated. Now it is better that we have the word, that is prevention is better than cure. So the same thing is there. Vaccines prevent the disease that can be dangerous or even deadly. Now they safeguard you by creating a immunological response. That's why the vaccine helps you in the immune system by producing the antibody, just like what you would have after a disease. So after getting vaccinated, you have the protection against the disease. Now that is the reason that vaccine is a very powerful medicine. So that should be there. Now all COVID vaccines have been shown to be effective. Now from this data, the most important thing is there that not only vaccination, but all other measures should have been in place. That is, many times you can see that the persons who are vaccinated, he may be feeling that now I am vaccinated, nothing will happen. No, that is a misconception. Vaccination, along with the social distancing, along with the hand hygiene, respiratory hygiene, all these measures should go hand in hand. That is very important here. So with this, I end with the short topic. Actually, this is a short topic regarding the vaccination, but I hope so that I have taken a part which should have been there. So I have, so any queries are there, I will be very happy from all the students, because all the students are there enrolled.
Yes, sir.
Yes.
So
Yes,
Thank
yes.
you, Dr. Alimuddin sir, for deliver a valuable information and guidance to our students. So now we are moving towards the second part of this webinar, that is
Yes.
question and answer session. So any student having the questions, they can
Yes.
ask to the honorable guest. ज्यांना पण क्वेश्चन विचारायचा आहे त्या स्टुडंटनी सर्वात पहिले तुमचा रोल नंबर, तुमचं नाव आणि तुमचं काय क्वेश्चन आहे तो विचारावं.
Sir, myself Akshita Nikarje. I'm roll number 254 from Cyber, second year. So my question is, even after getting vaccinated, some patients get tested for COVID. So why is it? So the process
Slightly you just raise the voice. Actually, some disturbance is there. Just you can raise the voice.
Or you can also write a question in
Yes,
chat
yes, yes,
box.
that will be better. I have opened the chat group. You can type the question. Yes, yes, that will be also good, sir.
Okay, every student, whoever have some kind of confusion, question, related webinar, they can write in your chat box. Sir will answer you. Okay.
Yes, 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 that will be very good.
Hello. Hello. Can you hear me, sir?
Yes, sir.
Yes, sir. Yes.
Good afternoon, sir.
Good afternoon, sir. Yes, fine.
Thank you very much, sir, for giving a time for on this holiday. That is a Sunday, and you have very nicely present all the pathology of these vaccines to
Yes.
our students. Actually, you reduce our teaching workload. You already taught the
Yes.
defense mechanism of the body and how the infection is proceed in the body and how we can cover this infection. So all management you have tell that also reduce our workload of our
Yes.
staff members.
Sir, we should try always to help others. That should be the motive, that we should have the education. Many times what I had discussed with the Joseph sir, that what is there is many times the dilemma is there regarding the vaccines in the society. So if we are not getting that clear message, actually what happens is the confusion is created over that. So
Yes,
that
sir.
should be very, very important. At least as a healthcare worker, we should have some initiative that at least we should explain to the mass what is there. Yes, sir.
Very true, sir. Sir, one my question is there.
Yes, sir.
Okay, suppose before the vaccination, if the person is infected with the COVID,
Absolutely. Yes,
and if you taken the vaccine, then there is a chances that cytokine level is must maybe increase at higher level, and there is a bigger chances of illness of that patient.
Okay. Yes, that is a good question, sir. I will explain one important thing. Sir, what happens is whenever we are getting vaccinated, antibody level, nowadays we are also having the test of COVID antibodies. Now, average COVID antibodies, they will take on an average 4 to 6 weeks. Okay. After that, what we are giving is a booster dose. So what happens is in between, if the person is getting infected, before that, what happens is there is an increased risk that he will have the same symptoms of COVID-19. Now, next question is, after the person is fully vaccinated, what is the meaning? That is, he has taken the 2 doses. For example, if he has taken the 2 doses of Covishield, after that, what happens is, most importantly, symptoms will be mild. That is, immunological response will be there. For example, the fever, myalgia, fatigue will be there. Even if the person is tested, he will be RT-PCR positive. The very, very important thing, many times what we are seeing is the RT-PCR is positive, but the patient is asymptomatic or mild symptom. Okay. So what happens is, what the vaccination purpose is there is, we are doing it to prevent the 2 important complications. One is the pneumonia, COVID pneumonia, and second is multi-organ damage due to the inflammation, what we had just discussed in the slide at the initial. So infection might be there, we cannot stop that, but the most important is prevention of the morbid complication where he may be hospitalized. Hospitalization will not be required in this case. A simple, many times it will go unnoticed. That is, the patient may not even notice that. The second important thing is, sir, here is the viral load. Now, what we have seen in the studies, or the studies have come, that the viral load, whatever the spread or the carrier is there, that viral load is decreased in the persons who are vaccinated. What happens is the spreader is now lesser. Okay, so the risk of spread with the viral load, what is happening is more of the respiratory tract secretions are there, more will be the spread or likely chances of that. That is also decreased when the person is infected, but he is having taken the vaccine. So that is the important issue in that, sir.
Yes, sir. Thank you very much. That I have the concern clear
Yes.
me.
Yes.
Thank
Yes.
you very much.
Sir, one student having the question, Tavan Ritesh, having the question of, will COVID-19 phase 3 will come in next year or not?
Which one, sir?
One student having the question, will COVID phase 3 or peak 3 will come in next year also or not? How many chances is there?
Now, that is the thing that what we have discussed is the most important thing is, see, COVID infection, actually, if you see the phase, after infection of the COVID, when it gets localized in the respiratory tract, most importantly, the infective phase is for 21 days. Okay, 21 days. That is the life cycle in a person where it will be shedding off. Now, here what happens is when the person is infected without vaccine. Now, without vaccine, if the person is getting infected, he will get all the things. What most important is the immune response. In the young age group, if you see, the immune response is very good. You can see that in young age group, even you can see that many of the persons are getting only mild symptom. Now, what we are concerned more is the elderly age group, comorbidities. That comorbidities means diabetic is there, hypertension is there. If that person is there with the comorbidities, now here what happen is the most important thing is we have to take care of all these persons. Okay, so for that what we had initiated is above the age of 45 we had initiated the vaccination drive to prevent the vulnerable population who are at risk. Now, second, even one discussion was there. Now it is regarding the pediatric age group or child. Now, in the pediatric age group, generally they are having a very good immunological response. So that's why the vaccine was not advised. Now the new guidelines are there that even third wave may be there with the children. In the children, the symptom may be there. That is the multi-inflammatory disorder syndrome. That is multi-organ inflammation will be there. So to prevent that, you can see that we are now getting prepared for the third wave. Now third wave is not for elderly, but now the third wave is for the pediatric age group. Now pediatric age group are being infected. So that is now a concern that we are more concerned. So even in the MGM Medical College now, a special pediatric COVID care center is being established. Now it is being established means the work is near to final now. So that is the thing, that new things are coming up and new challenges are coming up every day nowadays.
Yes, sir. Sir, one question from Akshara Chavan.
Okay.
So, this question is how children will affected from this COVID-19 diseases more in third wave?
Chat is disabled to chatting, sir.
Can you just make it in the chat so that I can get the question?
So the chat box is disabled.
Sir, chat box is disabled, sir.
Okay, fine.
One minute.
Just,
So students directly ask question to sir now.
Okay.
okay, just raise your hand. We'll take your name and you can ask the question. Okay.
Yes.
Yes, Ashirwad Moore. You can
Okay.
ask question.
Sir, there are many rumors in our people, sir, that if we take a vaccine, some pain in our hands.
Correct.
Is this true, sir?
See, that is a good sign. Actually, what in our response we say that yes, your body has reacted very well. Even when I was vaccinated, I had a big boil-like thing that ruptured. So that is called as a bleb. Now, what is it? It is an inflammatory response. Whatever virus vaccine we have given, when the body reacts to it, there will be a fever. Okay, so what is there is, that is a good sign actually. So it goes off. Actually, it is for some, in some persons average days are 8 days. Okay, for 8 days you will get the symptom, that is fever, myalgia, fatigue. These are the presentation symptom of COVID response. Okay, these are not COVID but COVID response. So that I had already told that fever, myalgia, headache, these are seeing many times the person, he has the body ache, joint pain, but these go off, they won't continue, the most important thing. And even if you are getting that symptom, what is there is the management. What is there? Simple analgesic like the paracetamol or even ibuprofen is given to decrease the severity of the symptoms, the most important thing. Next important is what we had seen at our Covishield vaccination center in MGM. Many times the person were getting the giddiness, चक्कर येणे खूप काही लोकांमध्ये येतं. आता हे कशामुळे आहे, तर हे येतं वेदर द पर्सन इज नॉट टेकिंग द ॲडिक्वेट डाएट. जेवण नाश्ता न करून आले, फक्त आले आणि डायरेक्ट वॅक्सिनेशन घेतलं. अनेक वेळा काय होतं की पेशंट इज ऑलरेडी हॅव्हिंग अ हायपोटेन्शन, ब्लड प्रेशर कधी कधी लो असतं, एस्पेशली फिमेल्स. आणि त्याच्यानंतर जेव्हा वॅक्सिनेशन घेतलं त्याच्यानंतर अनेक वेळा पेशंटला चक्कर येतात, बट दॅट इज अ टेम्पररी फिनॉमिना. तर त्याच्यामध्ये काय आहे की जनरली नाव व्हॉट वी आर इन्स्ट्रक्टिंग द पेशंट इज टेक ॲडिक्वेट फुल मील. After that, what we are taking is the blood pressure, temperature. If the person is already having fever, maybe the immunological response will be there. So that's why he is getting more symptom. Okay, so that is only a immunological response. It has nothing to do with the severity. No severe symptoms are there. Yes, sir.
Thank you, sir. The next question from Vaibhav Vadgavkar from the YouTube live streaming. Can humans become infected with a novel coronavirus from animal sources?
Yes. The most important thing, that is the various theories are there. Actually, the most important theory is there that in the Wuhan, actually these are having the food habits that they are eating the bats. Now, already what has happened is the source, if you see, even the swine flu was there from the China. Okay, so here the most important thing we are concerned is the same thing, transmission, how it has transmitted. Now the investigation is going on from the World Health Organization, but still the most important is that word what we have seen. Even I have attended many workshop online. One thing is that we are playing with the nature. Actually, the one word is there that we are playing with the nature. And these are all the things that we are getting due to the playing with the nature. Whatever the nature we are disturbing, and that has created this havoc. The most important thing is there.
Yes, sir. Sir, next question from YouTube live streaming.
Yes, sir.
Will ask question to you. Sir, how will this corona vaccine affect, sir, even after the getting vaccinated? Even after getting the vaccinated, why do people still get it infected?
Now, I will get to the answer. Now, important question is there. Now, see here, whenever a virus is there in the environment, okay, a coronavirus or any other virus, when a virus is there in the environment, most importantly, there is a phenomena of survival. Okay, every person wants to survive. A virus phenomena is there for the survival. The most important thing is there that the infectivity index of this virus is going down now. Infectivity index means the more severity grade of the symptom. Now, except the mutation, now Delta mutation was there, but the other mutations caused lesser infections. Okay, so in the nature, it is expected that down the line 2 to 3 years, this will be a normal like a flu or a cold. Okay, but here infectivity will be there when it has been there. Now, last year, what the epidemic is there, and today, what the epidemic is there. If you see the scenario, at least we are aware now. Due to the awareness, you can see that rapidly control of this infection is there. Now, remember this thing that the nature itself is one of the answer to this. That as soon as the infectivity, it will go down with the coming years. Till that time, it will be infective. Now, the question is there regarding the prevention. So, whatever the data is there with the vaccine. Now, last year we didn't have the vaccine data. Now we have the vaccine data that is there in the Moderna is there. In the US, it has been vaccinated. So with that vaccination, we can train our immune system because there is no other alternative except training our immune system. We have to be strong, and the vaccine is only the solution to make ourselves strong. So that is actually the take-home message that why vaccination is important.
Sir, one question from Ritesh Dongre. So, Ritesh, you can directly ask question to sir.
Okay.
Ritesh
Yes.
Dongre.
Sir, he is asking that what is the percentage that if we take a vaccine, how much there is a chances that we will get corona again?
See,
What are the chances?
that is a very important thing. Corona, you may have corona. Now, I'm telling you the fact in our MGM Medical College, actually. I have been infected one time. Now, the resident and the doctors who are working in the wards, now they have become COVID positive fifth time, 5 times, fifth time, I'm telling you. Not one time, not two time, not three time, but how many time? Fifth time. But not showing any symptom. Why? Because they are continuously being exposed. But most important thing is, after vaccination, what has happened? The most important thing has happened is virus infection we cannot prevent. But the most important thing, as we are immune to that, so infection will not be there. That is, the severity of the infection will not be there. We cannot stop the infection. So the most important thing is the same thing. What I have given example is many of the doctors in not only MGM Medical College and all other hospitals, even in AIMS, you can see that they are getting infected 4th time, 5th time, they are coming corona positive, but symptom are not there. And the final is there that the one resident of MGM Medical College in Navi Mumbai, she has expired recently, just 15 days before. So she had got second COVID and she expired. Now that is due to the immunological response. If your immunity goes down, no one can help you. The most important thing is vaccination are there. They are the only measure in our hand to help you out. But if you are having any decrease in the immunity, now immunity is one of the thing which is only to your body. Two persons are there in the whole system, but both are having different immunity. So many times you can see that the whole population is not infected. Even in India, you can see that many persons are infected but don't give the symptom. Why? Because they are already having a good immunological response. Okay, so that is the thing, that infection cannot be stopped. That is the reason you can see even on the telephone what they are doing. Take the vaccine, but remember that you have to have the safe. That is the use of mask, have the social distancing, and all the preventive measures should be taken even after vaccination. Vaccination will prevent the complication but won't stop getting infected. That is the most important message.
Okay, sir. Sir, the next question is that since now in Pune the vaccination for kids is available, how safe it is and what are the precautions we should take?
Now see here, whenever you are getting vaccinated, the most important thing is there that you are still at risk for at least 4 to 6 weeks. So vaccination itself will give an immunological response in 4 to 6 weeks. So at that time, in between, if you are getting infected, vaccination won't help you. Why? You can see many times, you can see on the television that many political leaders, they had been vaccinated, but even after 8 days they became COVID positive. That was not the reason due to vaccine. Vaccine immunological response will come after 4 weeks. In between, when that is there, so what is there is all the measures, preventive measures should be taken along with the vaccination. Now, the same thing is the take-home message.
Yes, sir.
So
Okay.
caution has to be taken even after taking the vaccine.
Okay, sir. I think we have taken every question. Yes, any students, if there is any question, still you can ask to sir. Okay. Sir, just I want to share a video that our students have created related vaccine only.
Okay, sir.
Okay, can I share a screen?
Yes, yes, yes. You can stream.
Okay, sir, my screen is visible.
Yes, sir. Yes.
Okay. Thank you.
Voice is not audible to all.
Sir, voice is not audible.
Sir, my voice is not audible.
Yes, video
Your,
voice is not available.
Video file share. Video voice not available.
Okay, just looking after it. Okay, now sir, voice is coming.
Yes,
Hey,
sir.
it's
Yes, sir.
audible.
Yes.
It's audible.
Thank you, sir.
Yes,
Thank you,
sir.
sir.
Hello everyone, myself Kishan Jaiswal. I am Assistant Professor of CS Institute of Pharmaceutical Education and Research. Today I am going to answer a questions of my TG students related coronavirus. Hope it will also help to you.
Hello, I am Kedar Khawal. Which one is more effective, Covishield or Covaxin?
Both vaccines are equally effective. Both are working well.
Hello, my name is Komal Gadhe. I want to ask, should we donate our blood or not before taking vaccine?
As most of the blood donors are from age group of 18 to 40. If they take vaccine, they cannot donate their blood for at least 3 months, which may result in shortage of blood. So please, I request everyone to donate their blood before taking a vaccine.
Hello everyone, I am Piyush Jaiswal. Well, my question is, should we wait for foreign vaccine like Pfizer and Johnson & Johnson, or we should take what is available right now?
No, we have a good vaccine. Yes, there is a shortage in vaccine, but whenever it is available, you should take the vaccine and not wait for any foreign vaccine.
Hello, I am Rutuja More. My question is, can pregnant women take the vaccine?
No, pregnant women are not recommended to take a vaccine.
Hello, Garuda Aniket is here. People are getting COVID even after taking vaccine. Does that mean vaccine is not effective?
No, it does not mean that vaccine is not effective. taking a vaccine just means that you may get COVID, but it will be of less severity, which may not cause a death or also ICU admission. Okay.
Hello, my name is Jadhav Manisha. Can you please tell us if vaccine is effective in new strain of coronavirus?
Yes. So far, whatever variants are documented, this vaccine will also help you to fight with it. In some extent, your body will be able to fight with it.
Pooja Madalgi is here. I want to know there is any long-term side effect of a vaccine.
You may get immediate post-vaccine symptoms like fever, body pain, arm soreness at the site of injection. But other than that, whatever studied and observed, there is no any other major side effects. For long term, we have to wait and watch. Now it has been 6 months that all over world people have taken vaccine, but there is no any major side effects.
Hello, my name is Kainisha. If I tested positive recently, should I wait for the vaccine?
If you have a COVID-19 recently, it is recommended that you should wait for 3 months or at least 90 days to take a vaccine.
Hello, my name is Kakadi Pooja. If I take both the vaccine, will it help me to avoid COVID-19?
No, it is not recommended to take a multiple vaccine. Also, if you have taken first dose of COVID-Shield, then your second dose will be of COVID-Shield only.
Yes, sir.
Yes,
It is
sir.
completed. Thank you.
Yes, sir.
Very good.
Thank you,
presentation.
Jaswal sir, for this wonderful COVID-19 awareness video.
Thank you, sir.
I hope students will aware from this video. So now I request to Maismale sir to deliver thanking speech.
Okay, yes, last but not least, vote of thanks. I am Mr. Mahismari Vinayak, Assistant Professor Cyber, and here for vote of thanks. So first of all, I would like to thanks to Dr. Shaikh Alimuddin sir for sharing this valuable information to our students and teachers, and really it's very helpful us in this pandemic situation. Now, I also thanks to our patron, Chairman Shri Basavaraj Mangalore sir, and Director Shri Prabhakar Mashalkar sir, and our Principal Sir Dr. Ganesh Tapadia sir, Cyper, and Mrs. Bhagyashali Pawar Madam, SYIP, who providing this virtual platform for this webinar. Next, I also thanks to all webinar coordinator who coordinate this webinar very nicely and smoothly. Now, I also thanks to all teaching staffs, students, and all other audience for listening this information carefully. Now, with the permission of principal sir, I will like to communicate that this webinar sessions will over. So I will hand over this toward the Patan sir. Thank you one and all.
Thank you. Thank you very much for giving me opportunity for getting it for all the students. I also thank the Shreyas Pratishthan for giving me an opportunity for presenting. I would hope in the future that we'll be taking such discussions in the future also.
Yeah, sure, sir.
Yes, sir.
Thank you very much, sir. Definitely, you have given your valuable time on Sunday. It is our pleasure to meet with you. Thank you very much, sir.
Thank you very much. Thank you all, Suresh Pratishthan, all the who have taken the efforts for making it a good presentation, because it is also one of the background team is also very important for making all these arrangements. It is not that it is a teamwork that is important for us. Yes. So, thank you everyone for that. Yes.
Thank you, sir. Thank you.
Thank you very much. I will discontinue, sir. Yes.
Yes, sir. Yes. Thank you, sir.
Okay, we can
Thank you very
end
much.
this meeting.
Thank you. Yes, yes.
So, Jaswal sir, we can end of this webinar.
Yes, sir. Yes, sir. I'm closing it.
Yes, sir. Thank you.